that would be phenomenal. Thank you, everybody. All righty. Since we're recording, I'm going to go ahead and get started. Good morning, everybody. My name is Renee Dillard. I'm Manager of Support Services for TCCN. I'm really happy to be joining you this morning to do a walkthrough of our new member engagement platform, Your Membership. You can find out more about our membership platform at the link that I am dropping into the chat now. But we are hoping to transition all of our members to this platform where you can update your own contact and clinic information. You know that Annabelle and I email you all the time asking questions about, have you had any changes in your operating hours? Have you opened up any new locations? And so you'll be able to go in and update that information on your own through this platform. There is opportunity for you to find community with other TCCN members, partners, and friends. We are transitioning exclusive grant opportunities and information about those grant opportunities to the membership platform. And of course, you can always find more information on the grants that we're currently running on our website. And I'll actually drop that link into the chat also because we recently updated it. And also, hopefully all of you have registered for our annual conference, but you do that registration for annual conference and for the pre-conference through your membership. So get your questions ready. I'm prepared to answer hopefully anything that you can dream up. And I'm going to go ahead and share my screen. Alrighty, so to navigate to our membership platform, there are many, many options through our website. As you can see, this is our homepage. We're always talking about our upcoming annual conference, Closing the Gap in Memphis, Tennessee. You can join our membership platform by clicking this button. You can also register for the conference on this screen, and it will take you to the registration page that is housed on the membership platform, like I was saying earlier. You can learn more about the platform and that link that I dropped into the chat, and also by going to membership, TCCN member platform. What I love about this page is at the bottom, there are some walkthrough videos from me that you can watch at your leisure that provide really useful information for setting up things for the first time in your membership. And if you have questions, please come off mute because I'm sharing my screen. I can't see you. So I have linked logging into the membership platform through that image. You see, I just clicked, and let me go back. When you're sharing your screen, it puts all of these little boxes. There we go. So, yeah, so this image on our website is linked, right? You can click here, and it will take you to the homepage of the platform. You see, I'm already logged in, and let me sign out actually, and hopefully it doesn't sign me out across everything. Yes, so you would put your sign-in information here. If you are a TCCN organizational member, you received login information directly from myself. So you already have a username and you already have a password. If you did not receive a username and password from myself or Annabelle, you're going to click Haven't Registered Yet and walk through this registration process. The really cool thing about this is if you are the executive director, for example, of an organization, you would have gotten login information from myself or Annabelle. You can give this link to register on the platform to your staff, and they can register as organizational member staff. You can register up to 10 employees on your team or have them register themselves, but they would go to organizational member staff. We also have an option if you are a non-TCCN member or if you are an associate member staff. So same thing, if you are one of our associate members, you should have received login information from myself If you have not, you can email me, and Annabelle, if you could drop my email into the chat for me, that would be great. You can email me at info@TCCN or at Renee@TCCN. I use them. I check them on my phone. I'm on them constantly. So if you have any trouble, you can email me anytime. He would walk through this registration process, selecting your member type. You would come up with a username, and we gave you an example. We like to use a first initial and then a last name. So let's see. Let's just do I'm naming after my dog, Benji. Last name's Dillard. Benjamin Dillard. Very bad, but I love him. You would fill out your password, your email, and then we ask these great questions. Are you a board member? Yes, no. The name of your organization so that we can tie you again to the organization you work for. Are you receiving our newsletter? Would you like to? The address of your organization. You see it says professional information. So this is all going to relate to who you work for. Your areas of interest. This is specific to you, just to help us better understand what kind of news that you'd like for us to share with you. And then how do you hear about us? Any questions on that process? All right, so the second thing that I want to show you, and I'm going to show you three things today. I have logged in as one of our members. So I've logged in as our friend Brooks from Appalachian Mountain Project Access. And I don't want to show too much of Brooks' personal information, but I did want to show how you could change your clinic information. Oh, my apologies. When I logged out, hold on, everybody. Let me stop sharing my screen for a moment. When I logged out, it logged me out of all the things that I had pre-pulled up for us. So let me just log myself back in as admin. And I'm going to log in as Brooke. Okay. So to change your profile information, you would go to Account and Settings at the top. And if you've logged into your membership before, you should recognize the screen. But you're able to go in and update what counties you serve, if you've added new locations. As you are a grant recipient, you can update that information. That helps keep us organized of who is participating in what grant. As you change your services, you're able to update that. You can add in your fiscal contact information, your grant contact information. And again, I don't want to linger too long on this so you don't see all of that identifying information, but we do ask that every one of our members goes in and keeps that information up to date for us, particularly the fiscal grant contact information, the fiscal contact information and the grant contact information. Mary Moore, who we'll be hearing from here in a little bit, is in close communication with those grant recipient individuals. And Annabelle is in very close communication with your fiscal contact, right? So if you are not the catch-all for all of those conversations, please give us that identifying information so that we know that we are talking to the right person. And the last thing that I wanted to show you, which is my favorite thing to show you, is I'm going to walk you through registering for our annual conference. Who here is registered? Can I get like some thumbs up, some high fives? I've registered. Exciting. Fantastic. And have any of you had some trouble registering for a conference? That's okay. We can troubleshoot any of that now. From our homepage, there are, again, many ways to do this. I think if you came to the social media webinar where I walked you all through how to do some things on social media. I might have shared this, but I think when you are thinking about your website and website management, always having multiple ways for people to get somewhere, more than 2, but fewer than 4, so it's not overwhelming. So you can register for our annual conference from our homepage, right, by clicking the register button, or you can go to 2022 annual conference at the top, go to overview, and you're also able to register from here. So I would click that register button and let me sign out because I've already registered. So I click that register button and I go down to register/RSVP. I can also view all the other people who have already registered. I click yes. So here's the part that I want you to really remember. You don't have to be logged in as a member. You don't have to be a member in order to register. It just asks if you are a member. You can sign in and then register, or you can register as a TCCN member. Again, that process that we were just talking about before you register for our annual conference. You don't have to do that. Anyone in your staff is welcome to register for annual conference without making a profile on our membership platform. You would just simply fill out your information. This is really important, what kind of food, how you're arriving, expected time of arrival, just so we can make sure if you're coming for pre-conference, we have a room for you. The room occupancy question, if you are bringing your family member or you are a parent and you are bringing a child and you need an additional bed. Other people who from your organization that will staying at the hotel, so we know who all is in your party. So TCCN is coming with our full staff. There will be myself, Nanabelle, and Mary Moore, and I believe our intern Claire is also coming. So there will be 5 of us. Your check-in and check-out dates, again, so we make sure we have a room for you. If you want to volunteer and receive updates, any other things that you may be interested in. And then the cool thing about this registration form is you can save and add another attendee. So you would save it. This exact same screen would pop up and you would be able to register as many people from your organization as you would like. Now, please note, and Annabelle can speak more to this, there is some cost associated for registering if you are not a participant of the Disparities Grant. Yes, everyone's nodding their heads. I got that right. Good. Annabelle, did you want to talk about that really quickly?
Yeah, and that goes along with what Mary Moore had been communicating to every member. She worked with everyone creating some budgets, right? But there's several clinics that are not participating in the Disparities Grant. Still, the first member or the first attendee for each one of our TCCN organizational members will be covered by this grant. Any additional participants will have to cover, their hotel expenses and meals, which is approximate, and travel expenses too, which is approximately $1,000 in all. As a reminder, and Mary Moore talked about this last week, we did a search and almost everyone passing the Nashville line, even in Chattanooga and also the ones, of course, at East Tennessee. At this moment, an air travel is cheaper than mileage reimbursement. So take a look at those numbers and, make the appropriate adjustments and reservations as quickly as possible. Not everyone within the Disparities Grant has registered already. And remember, there is a due date that we will be posting soon in our website. We have about 2 more weeks left of registration to be open and confirmed to the hotel. Not that people will not be able to register, but we need to give a number to the hotel, as you all know. So it is important that any one of you that needs any additional information, of course, the speakers, what we're doing with the speakers is that we will cover their expenses to be there with us, but we're not paying any fees. We're trying to be very diligent with the funding that we get from the Disparities Grant, and exhibitors or sponsors, depending on the level of sponsorship or the exhibitor level that they have chosen, they may have one or two registrations included in their packages. Everybody's package is different. That's why we're very careful not to add all these details in the website, because we knew that it was going to get really complicated. But if you have any questions, you can talk to any of us at any time.
The very last thing that
But we want to see you all. Sorry, we want to see people there. We want to be able to hug everyone.
And the very last thing I'm going to show you before I turn over to Mary Moore and hop off is that we really did want this to be a place where you find community with other members. And so when you are logged into your membership, you'll see at the top left, it says My Feed. You are able to write on this like it's any other social media kind of engagement platform. You're able to connect with other members. So I can click on Annabelle's name. I can write her. I can email her. I can post on her wall. I can write her a message. I can add her as a friend. I can't believe I hadn't done that. Well, I think Benji, my dog, added you as a friend. So I'm sorry, Annabelle. But you can see all of those connections that you made at the connections button. So I see Project Access West Tennessee has added me as a friend, which is super exciting. And you were able to directly message those people across the platform and find community with them. Any questions about your membership? Thanks, everybody, and see you at annual conference.
Thank you, Aklisha. She needs to hop off. She has another meeting to attend, but now
I'm notorious for being double booked.
Yeah, but now Mary Moore will continue. Thank you, Aklisha.
Thanks,
And
Renee.
Annabelle, make sure it records after I leave.
Yeah.
Okay.
Yes.
Yeah, that was very helpful, Renee. I need to get in your membership myself, and I've registered, but I need to play around in there some more. So it's a good reminder. All right. Well, thanks everyone for joining us. I'm just on one screen today, which is different for me. So yes, if Annabelle and Mary can help me look at the chat, if folks have questions, or you can just come off mute and ask your questions, because I won't be able to necessarily see the chat. So, um, but I want this to be interactive. I have a feeling that there are quite a few questions about where we're at with grants right now, what we have coming down the pipe. So that's why we chose this topic for our monthly webinar this month, because we have a lot of changes and a lot of things going on. So all right, as far as the agenda, Renee already handled your membership for us. So what we'll start with is an overview of our current grants, and a helpful grants timeline that kind of shows where all the grants start and end and where they overlap. Right now, we're in a heavy period of overlap, which is a great, exciting thing. And then we'll talk a little bit about grants management, just some reminders and tips. And there will be an opportunity for questions there too. Okay, so as far as our current grants that we have subawardees participating in, we've got disparities. That's been the focus of everyone's attention here lately as we've been working together to get budgets finalized and amendments signed. We're so close to 100% of amendments signed. We only have 2 outstanding. So that's very exciting. We've gotten invoices for July now. We're processing those. Hope to get this to the state by tomorrow, so that we can get everyone paid. So again, that grant officially started June 1st, 2021. And it goes through the end of May next year, 23. So we've got about 10 months left on that grant. And the scope, I think everyone knows by now, is reducing health disparities, particularly COVID-19 related health disparities. And another important thing about disparities is that it's the focus of our conference, closing the gaps, and it's funding much of the conference. So the column on the far right, we've got, just to kind of keep up with CHWs and which grants fund CHWs, because right now we do have a lot of grants that are funding CHWs in one way or another. So we just want to kind of keep that clear in everyone's mind, which grant is which. There are several subawardees under disparities who have included a community health worker salary in their budget. So there are some community health workers now that are being funded by disparities, whereas before, all of our community health workers that were funded were either funded through TCCN's Community Health Worker Grant from TDH or through the HRSA Sustento Grant. So, community outreach is the big new news. It technically started July 1st. We're still waiting on the contract from the state, but that one goes through the end of June. I can't believe I'm saying this, but 2024. It's amazing. Every time I see it, though, I'm like, oh, that's so, I mean, it's a little bit less than 2 years. So, I mean, the grant is for 2 years, so that's great, but it seems like way off in the future. So I'm really going to start panicking when we see 2025, I think, on things. So we're still waiting for the contract from the state. And we want to wait until we get that contract before we get too heavy into the conversation about subawards, because we just want to make sure that the scope that we're given from the state, matches what's in our proposal, and that we have a great understanding of it so that we can give you all really clear, discrete guidance on how to apply for your subawards. It's going to be more of a uniform process, whereas disparities was a little more open-ended as far as what your clinic's particular needs are. The community outreach grant is going to be it's more focused on funding community health workers in particular. So we're going to be providing descriptions of those positions, what the requirements and duties need to be. And then giving some guidance on, if you're asking for one CHW, kind of this is the salary and benefits amount you want to ask for. If you want to ask for two, this is what you would ask for. If you want to ask for some supervision, this is what you would ask for, etc. So, and there may also be some money in there when we get our contract, we'll see, for distribution and administration of COVID-19 vaccines. So if your clinic is not already a registered COVID-19 vaccine provider, there may be some funding to help with completing that process. So those are some kind of outstanding points of clarification that we're waiting for on that grant, but we're very hopeful to really get the ball rolling here in September. So CHWs are funded under this grant. That was the primary focus of our proposal, because the grant is funding community outreach, and community health workers are an excellent way to accomplish that. Then we have the CHW grant that has been ongoing since June of 21, and that goes through the end of this June 23. That funding is from TDH as well, and it's specifically for funding CHWs. It was a smaller amount, so we just had 7 subawardees under that grant, so that's ongoing. The HRSA Sustento grant, many of you are participating in. And of course, again, that grant is your contract is with Sustento. The funding's from HRSA. TCCN's role in that grant is that we are the state lead. So that's why you hear from us when it's time to complete your reports and ensure compliance, because that's our role in that grant, is to help as a kind of a liaison between your clinic and Sustento to make sure that everything is getting reported properly and everyone's in compliance. And they recently accepted some applications for additional funding, so that's great news. And then quality improvement. This is a new contract, so I'm not sure how many know about this. I don't think we've announced it in the newsletter yet, but I could be wrong on that. The quality improvement contract is also with TDH. It started July 1st, and it's going through right now April 30th of 23. But if you see that little asterisk, that means that there's a possibility of an annual contract. So the way the contract reads that we've received, and then based on conversations we've had with TDH, There's the impression that this will be hopefully an ongoing contract, an ongoing position. Really, what this contract is funding is for us, for TCCN, to hire a director of quality that will be working with the clinics, particularly those who are participating in the safety net. And the goal is to increase equitable access to care by improving the quality of patient care and just creating a quality improvement culture. So I'm going to pause right there and give everyone opportunity for questions while we kind of marinate on the beautiful graphic timeline that Annabelle created.
I know that sometimes the terminology gets really confusing because essentially there may be community health workers in all those grants. But it's really important that at any time, if you want to communicate to us, if we ask, okay, which grant we're talking about, is of course because we thankfully, thanks God, we have a portfolio of grants for which many of you are participating. And of course, we want to keep growing this portfolio, but we want to make sure that when there's some information that we have provided, like billing, and sometimes, you know, every time we talk about compliance, there are many topics there that are the same across the board. You will notice that some of the things that we will talk today and in future meetings are applicable. It doesn't matter if we're talking about funding coming from HRSA, from the CDC, through Sustento, or through TDH, or through us. It's the same. Compliance for federal funding looks and feels and tastes the same. But we want to make sure that are covered, that we can provide you as much information as possible. But there's some differences. So whenever you approach us, let's make sure that we use some of these names right here. So we are sure that if there's anything in particular, especially with the scope of service, that we are providing you the appropriate information. But as you can tell here, we're so happy that we got you covered for 2 more years with, it's a lot of work for all of us, but it's a good funding. So yay.
Yes, I didn't talk about amounts previous, but if for anyone on the call who wasn't aware, community outreach is a little under $8 million for the 2 years. So 3.9 million for each year, which is about twice the budget of disparities. So it's a really big opportunity. So that's very exciting. And you'll notice, in case anyone's wondering where equity is, I don't want to, equity is over. Um, the community outreach funding is technically the same funding stream, but we really don't want to confuse them. So in one way, it's an extension of equity, but a lot of the goals are going to be different, and the work that we're doing is going to be different. So we just wanted to kind of make a clean break by going with the community outreach name of the funding, so that we don't confuse that. So. All right. Well, if you don't have any questions, we can go on, but again, please don't be shy. Come off mute if you have a question. So with all of these grants, and especially a lot of them having kind of similar, maybe seemingly similar outcomes, funding similar positions like CHWs, I've gotten, and Annabelle's gotten, several questions about double dipping. And it shows that you all are really good stewards of your funding because you're wanting to make sure that you're not double dipping. That's like a scary term. And you want to make sure that you're doing the right thing. So we really appreciate that. And we just wanted to take a minute to kind of clarify what is double dipping and what is not double dipping, and then how to avoid it. So double dipping is charging 2 or more grants for the same costs. So for example, if you receive 2 grants and they each fund 100% of a community health worker position, but instead of hiring 2 community health workers, your organization only hired 1, and then build both grants for that same position's personnel expenses, mileage, or supplies, that would be double dipping. That would be bad. I don't think anyone plans to do that, but so that is the definition of double dipping. It's basically taking money and then charging 2 or more grants for the same thing. Double dipping is not properly allocating one position across multiple grants and funding streams based on the time and effort of that position. So it is perfectly all right, for example, if you receive 2 grants and they each fund 50% of a community health worker's position or an admin position or whatever the position may be, and you hire one person and you bill each grant for 50% or whatever the proper allocation is. That is okay. That's not double dipping. You're receiving 2 different funding streams, but it's discrete because this person's spending 50% of their time on activities for this grant and reporting to that grant, and 50% of their time on activities for the other grant and reporting for that grant. So that is okay. It's also okay. Sorry, let's go back for just a second. It's also okay if you have 2 different grants that fund community health workers, as long as, again, there's either 2 different positions or it's not, as long as it's not overlapping. So some of you who are currently on the TDH CHW grant that ends at the end of this coming up June, if you want to apply for the new community outreach grant, even though it started already to fund the same position, you could. You would just want to have it pick up July 1st, 2023, so that there's not an overlap. And we can talk more about that when we get to that subaward process, but just another example there. A note about
Mary,
allocation.
If you allow me, going back, you
Please.
used an important word, overlapping. As you can see, and as you may remember from the previous slides, there is some overlap, you see. And what is really important is how you collect your, you keep your records straight, especially with payroll records, that you can show maybe this person, yes, it was in 3 grants until June. Then after June, it was only on 1 grant. And we're going to give you tips on how you need to keep that information updated. There is no problem if somebody changes every month. We hope not, but it could happen. But it is important that you don't feel concerned that, well, but last month this person was in 3 grants, will I be in trouble? No, if you have the appropriate documentation, of course. So what Mary's going to show you now, especially there is one particular report that is the exact same thing that even HRSA is asking. They got to this next level of, this is the top-notch thing that you could do to show what's happening. And that's why this is going to be required monthly and under the HRSA grant. And it is something that Sustento is currently communicating to everyone. And it's the time and effort, documentation. And the reason for that being is that we are no longer seeing grants that will follow the standard, fiscal year for state or federal grants. There's nothing else running by October 1st and ending September 30. No, we are all over the charts. And sadly, it gets even more complicated sometimes because the contracts are not being executed on time. But what we need to remember is that word that Mary used, overlapping. How during one period of time, you have someone divided between different grants without exceeding 100% of their time. A contractor may be a different thing. We're talking about staff. And when we talk about staff, remember that based on IRS standards, staff means someone that will receive a W-2 at the end of the year. And that's another topic that we want to talk our TTA at the end of this month, because we get all these questions and we want to make sure that you understand everything. Okay, we don't want anyone to be experts, but we want everyone to feel safe with the information we are providing. And before we continue, I know that there's several questions, Mary,
Great.
in the chat right now. Cindy asked again about the amounts, but we clarified that. Helen, no, sorry, Sherry wants to get some clarification about the CHW grant and if it's too late to enroll.
The TDH CHW grant, it is too late to enroll for that one. We have the 7 CHWs, and that's the capacity of that grant. But community outreach, which will also fund CHWs, we haven't even begun the process yet. So we're hoping to start that again as soon as we get the contract, hopefully at the end of this month, and then we can start looking at that in September and October as far as making subawards. Anything else right now?
No. Mary Kiger answered Sherry, and and Sherry says thank you. Okay, cool.
Great. Perfect. Thank you, Annabelle and Mary. Okay, so a note about allocations. While we're talking about allocations, your organization should have a system for tracking staff allocations across all grants and funding streams. So certain grants, like for example, in the disparities grant, we're asking you to complete, along with your invoice, a spreadsheet showing the allocation of the staff billed to that grant. And HRSA is asking for something similar with or Sustento's asking for something similar with the HRSA grant. But that's very important. But in addition to that, you should also have a way to track it across your organization. So a spreadsheet that has every staff member and each grant that they're on, to make sure, again, that no single position in any given month is ever exceeding 100%. So you wouldn't be able to bill one position, 50% of their salary for one grant, 50% for another, and then 20% for another, because that would be 120% of their salary. And that would be another example of double dipping. So it's really important to have that system in place. It can be a very simple spreadsheet. It doesn't have to be elaborate, and it just needs to be updated. Another note while we're talking about this, say that you have a position that's currently funded by 2 different grants, 50% by one grant and 50% by another. That doesn't mean, even though that position is currently 100% funded, if a new grant opportunity comes up that maybe, lasts longer or is a better fit for that position, whatever may be, you can still apply for another grant, even though that position is currently 100% funded. Like, say you apply for a new grant and you put on your budget that if you get this grant, 25% of this position will be billed to the new grant. That's fine. It's just really important to follow through that if you do get the new grant, when it begins, that you go back and adjust the allocations on the 2 existing grants, again, to make sure that you're not exceeding 100%. So in this we'll talk about this more in the next slide, but it kind of goes into your thinking about grants as well. So just because a position is 100% funded, when you're looking at a new grant opportunity, if it's a good fit for that position, you don't need to have in your mind just, oh, well, that position's already taken care of, so I can't use this new grant. You can apply for it. You just have to follow through and adjust allocations on the other end. Time and effort should be reported and documented within your organization as well, periodically. A timesheet alone is not enough to document time and effort unless, and this is not probably a common situation, but unless you have a clock in, clock out system where they use different codes for different grants or different activities. But that's not the norm. So in general, clocking in a timesheet is not enough to document time and effort when we're talking about a position that's allocated across different grants. If the position is 100% on a grant, then that's fine. But if somebody's allocated across different funding streams, that wouldn't be enough. But it could be as simple as a quarterly attestation that the current salary allocations match the time and effort that they're allocated on, just signed by the staff member. And that's not something that we're asking for. That's just kind of a best practice for your organization that you document that. Managers should also be checking in with the staff that they supervise periodically to make sure that the allocations match their actual time and effort, and then adjust those as needed. So again, we've gotten a lot of questions about, can allocations change from month to month? Yes, they can. Again, we kind of hope not because it's a lot of work on everyone's part, but they can and they really should if the person's time and effort is not accurately reflected. So if they give you feedback that, well, I know I'm 50% on this one grant, but I'm really only working on this other grant, then it needs to be adjusted periodically. So
Before you
mhm.
continue, and this is a great question from Sherry. She wants to know if we have an example of a form like this. Yes, we do, and we're going to send it your way, and to everyone, so you guys can use it. There is the time and effort document, but there's also how you allocate the time. It could be in an Excel spreadsheet. We can help you put together one. The ones that we have been using in our grants are the great example. It's the same one that we developed for Sustento when they were starting with HRSA. But that is a way that you can allocate, you can create your budget with it, your agency budget, your clinic budget, I should say. It's a great way of also comparing what is happening later with what you budgeted and where the changes are. But for many of you are using QuickBooks or maybe using ADP for payroll, maybe just using QuickBooks for payroll or just for accounting. Remember these terms. They usually use either the word grant allocation or billing codes, or they could be using programs or departments. QuickBooks uses the word classes a lot. So any of those could be easily programmed to help you track your people, the time for your people in different scenarios, in different areas. If you need any assistance, depending on which platform you're using, finding out which one of those is available for you, because everyone that has QuickBooks desktop or even online, that is already there. If you need any assistance, let us know. We can help you, or we can talk to whomever prepares your payroll or does your accounting. But the basic is an Excel document. It's the easiest way of keeping track of this. But there are different tools that you could use, and just make sure that you're checking in on time, any now and then.
This is our last content slide. Before I go over this though, let me paste this into I can't do it this way here. Sorry. Let me go ahead and paste the link to the evaluation in the chat so that everyone can start working on that. All right. So this is just a note about kind of thinking creatively with these new grant opportunities that are coming, and then other grants that you're looking at outside of what TCCN may be offering. So when you're considering new grant opportunities,
Change the slide, please. You're at the
oh,
evaluation slide. I'm sorry.
oh, no, it's fine. I changed it on my end, but are y'all still seeing the evaluation slide?
Yes, the evaluation.
Is that better?
It's still there. You're still evaluating.
Okay, I'm not sure what to do. Now? No.
Nope.
Okay. All right, let's try this again. I'm on my Ethernet now too, because I wanted to get on my Ethernet today to make sure I didn't have any Wi-Fi hiccups. How are we doing now?
Yes.
Great. Perfect. Okay. So when you're considering new grant opportunities, if you can identify areas of your budget that are currently covered by unrestricted funds, so examples of unrestricted funds would be like if you have revenue from your clinic, I know some of you don't, but if you have clinic revenue or maybe other unrestricted funding, donations, things like that. Um, and so say you have a position and it's currently funded by these unrestricted funds, but it's a really good match for this new grant. You could apply for the new grant to fund that position. And then the money that is freed up, that unrestricted money, you could then use elsewhere, like to pay provider salaries for capital improvements, equipment purchases, etc. So just a note, because I know sometimes it can be frustrating trying to make a grant work when you say, oh, what I really need is money to pay for a new dentist. Or, we really need to remodel this exam room, or we need a new exam table, and this grant won't fund it. So that's just kind of a note. Of course, you still need to be abiding by, what the grant wants. So if they want to fund like a new program, you need to show how funding this existing position is going to accomplish implementing this new program. So it's not just about swapping money one for the other. You still, of course, have to meet the objectives of the new grant. So it has to be a good fit. But that's just something that I wanted to bring up because those are some conversations that we had one-on-one with subawardees during the budgeting process for disparities. And just wanted to kind of put it out for everyone, especially with new grants coming up, to kind of keep in mind. Any questions about that? Okay. Again, if you could complete the evaluation, we would really, really appreciate it. And as far as upcoming webinars, this is a change. So our TTA webinar this month, we were really hoping to do the community outreach grant kickoff, but we're going to have to reschedule it because we still haven't received the contract, and we don't want to put the cart before the horse. We want to make sure that we have the contract before we do that meeting. But the new topic is going to be very important and relevant because we need to do our Title VI training annually. And we'll talk about some more grant compliance topics as well. And then in September, we don't have any webinars planned because it will be all hands on deck preparing for the conference. And then the last week of September, we'll be at the conference. So that's what we have coming up. And that's the end of my presentation, but I can hang out for a few minutes if anybody has any more questions. If not, thank you for joining us, and the meeting's being recorded, so you can share it with other staff as well.
If you have questions, reach out to Annabelle or Mary, and they're really your best content experts in this area. I can give you hugs and support, but they have knowledge.
We can also give hugs and support.
Yeah.
Oh, that's true. I kind of meant that was my whole thing.
And also
Annabelle
remind
can give hugs.
Yeah.
I said Annabelle can give hugs. I'm not as big of a hugger.
No,
I am. So
three children, you don't want to get hugged anymore.
Yeah, I have too many little kids. I get hugged enough.
That was great. That was so helpful. I can't believe there aren't questions. I just don't believe it. That's why I wanted to remind people they can reach out to you.
That's very true. There is a question for you, Mary,
Oh,
in the chat from Bobby.
from Bobby. Ah, as for my replacement, a replacement will be announced, I believe, Monday or Tuesday of next week. The board has done a fabulous job. It's going to be revealed. We all have to wait for the big reveal, but it's very close, and the new executive director will be attending the conference with me. Transitioning will begin in September, if not a little before, and so exciting, people. How was that? She might not be on there though, huh?
That was great. Oh, she's still there.
Good. Okay. Well, a lot of people are hanging out. So you
Yeah.
guys unmute and jump on, ask your questions, anything you want to talk about with TCCN, we're here for you.
I have a question. This is Sabrina. And hello, everyone.
Hi,
Uh,
Sabrina.
Hi. My question is in relation to behavioral health specialists, mental health. What direction is the Tennessee Charitable Care Network looking into with possible ways to have funding for some of these clinics that, like Helping Hands, do not have a mental health provider or mental behavioral health specialist? So, is there any thoughts behind that you can share?
So, I'm just going to jump in and tell you on behalf of the team that we really do want everybody to have more of that capacity. We are really trying to figure out how to get funded because we're not actually a mental health. And guys, you jump in too. I just want to reassure people that we're all over it. We so value that integration of behavioral and mental health and really, frankly, addiction services, a lot of services that have not traditionally, Hep C screening and treatment, things that traditionally haven't been in the interior of our clinics. They're really important to build in as possible. So yeah, we're seriously looking into how to do that. But because the structure of the mental health and substance abuse agency is so different, and we're not considered, it's been a little unclear how we can access funding for that. And right now, Tennessee Department of Health is not funding that in any of the grants we're, being made aware of. Mary and Annabelle, you want to follow in and add on?
Thanks, Mary. And thanks for bringing that question, Sabrina. Just echoing what Mary said, it's definitely something that's on our mind. It's on our list. It's what we're looking at. So hopefully we can find some opportunities in the future. And it's really great to hear that feedback as well. I hope you can come to the pre-conference, the mental health first aid. It's not a solution to not having a behavioral health specialist on staff. I don't want to equate that, but that's one reason that we chose that topic, because we're hoping to just give staff who just at least the tools to know when you encounter patients that are struggling in that way, that you have tools on how to refer them and assess them and things like that. So,
And what I would like to add to that is that that's also why we're working on identifying new partnerships. And because if there's no funding available out there, then we can establish some kind of partnerships and collaborations with other organizations that could or be interested in providing services like that, maybe telemental health. So we're looking at it in all different angles.
Perfect. Thank you.
you're welcome. I know there's Faith Family is rolling out a new program. I don't know if Sherry's still on because the name is escaping me right now, but it's a
I'm here, Deb.
telehealth. Okay, yeah, could you share the name? I'm sorry, I'm blanking on it.
So we're unrolling. We're in the pilot phase. We've unrolled Health Pass, which is a direct primary care product that we're using. So we're targeting nonprofits, small employers, those who are not able to offer. Is that what you're talking about, Mary? Or are you talking about? Sorry,
That sounds very interesting. I was talking about is it synchronous health, where there's it's like there's an AI component.
We do.
Okay.
So we have a relationship with Synchronous Health. Our board member is associated with them. But we have access that we provide to a cost-effective solution for our patients who pay a copay, and they have access to mental health providers. And then there's also software that's called Carla that the provider and the patient use to communicate and set goals and life changing goals that is set and run by Carla. So it's usually 8 sessions. And so we've had really good luck with that. We've set up stations here where the patient, if they don't have access to Wi-Fi or a smartphone, they can come in here and do telehealth with that provider, or they can do it at home if they do have Wi-Fi on their cell phone or their tablet. So it's worked really well for us.
Great. And I think the is the copay, is the $35 copay, is that like standard, or is that just kind of what y'all?
It is. So it's a standard $35 copay. It's just a flat fee rate on non-sliding scale.
Okay.
So we've had really good impact with that. And the patients have really responded to that. So we're getting ready to do a campaign where we really push that for our patients.
Awesome.
Plus, we have a behavioral health nurse practitioner who helps with medication reconciliation. And so those two working hand in hand with that platform has been a really good solution for us.
Great. Well, we look forward to hearing about how that goes, and maybe we can reach, we'll touch base about maybe going through your board member, but it would be nice to have them come on and do a presentation for our members about their services, because that could be a good solution.
Yeah, I was just going to say, if you
be happy to do it.
Share a contact, that would be so super. Just you can email any of us and we'll follow up.
Great.
Thank you. Do other people have great resources, say, on mental health that we don't know about? Because that's a great use of time to find out. We also hope that all of the community health workers and as Mary was saying, others who just have any patient contact at all will join us for the pre-conference. It's paid. We really want to make people or help people have access to this training because it is so useful, and it's such a prevalent experience in the clinic, I know, to see people who are in real distress. So being equipped to step into a hard situation effectively and know how to, refer and handle hard conversations is critical for everybody, CHWs especially.
Mary, this is Deb. I would also add to frequently check with the National Association of Free and Charitable Clinics. They recently had a behavioral grant through CVS Foundation, and we actually were awarded one of those.
Great.
So those can be beneficial for startup support.
You have to be a member, which is a little more expensive from most people than TCCN, but it's really worth it because if you get a grant, it's worth a lot. Can you tell us what that grant does for you, Deb? And congratulations.
Oh, thanks. Yes, we're actually expanding services. We've had a psych nurse practitioner 2 days a month for a few years, but we now have added a licensed clinical social worker. So we're going to be doing more of an integrated care model within embedding her in primary care. So we'll have the support of both therapy as well as med management.
Oh, that is just beautiful. That's great. Congrats.
Thank you.
Anybody else? Okay. There are other resources. We will be delving into them because we know how critical this issue is. So, okay, if that's it for today, should we wrap it up?
Yeah, sounds good.
Okay.
Thank you all for joining again, and reach out with any questions that you have, of course, as always. So everybody have a great day.
Wonderful to be with you all. See you soon.
Bye.